You brush, you chew gum, you gargle with mouthwash. For a few hours, maybe a whole morning, you think you've won. Then the cloud returns. The stale feeling in the back of your mouth, the way your coffee breath seems to linger like a fog on your teeth. If this sounds familiar, you're not alone. What if the reason it keeps coming back isn't a lack of mint or a bad toothbrush, but the food you reach for every day? Today, we're going to follow that question straight to a surprising claim in the title. One common food category is responsible for the vast majority of diet-related bad breath. The title says 90%. That's a headline-grabbing number, and we'll treat it with caution. Consider it the claim we're investigating, and we'll flag the evidence for it so you can check the sources yourself. More important than the exact percentage is the idea behind it. A single, ubiquitous type of food creates the perfect environment for the bacteria that make breath smell bad. If you understand that mechanism, you can change the pattern, and the results can be immediate, practical, and mostly within your control. We at Health Wisdom aren't doctors, but we want to give you clear, evidence-informed ways to reduce chronic halitosis through smarter choices. This video will do three things. First, give you a quick, punchy list of the top diet and lifestyle culprits so you can spot what might be fueling your problem. Second, dive deep into the real heavyweight offender, refined sugars and refined carbohydrates, and explain exactly why they're so uniquely damaging for breath. And third, start building a toolkit of practical swaps and daily moves you can use right away to take back control of your mouth. If you felt stuck by breath that won't go away, stick with us. This isn't about hiding the smell with more mints. It's about getting to the source. Before we move on, quick check. If you've struggled with chronic bad breath and tried everything from flossing to glittery mouth spray, type 1 in the comments so we know you're with us. Now let's move fast through the top dietary and daily culprits. I'll number them so you can keep track. Each one comes with a one-line explanation of how it contributes to bad breath and one immediate swap you can make today. Think of this as a quick map of the most common saboteurs, the things to watch for on your plate and in your routine. 1. Refined sugars and white starches, candies, pastries, white bread, soda. Why it matters? Sugar and simple carbs are the favorite fuel for anaerobic bacteria that live in plaque and on the tongue. When they feed, they release volatile sulfur compounds and other foul-smelling metabolites. Swap. Replace candy or pastries with a piece of fruit plus a small handful of nuts, or choose whole grain bread paired with protein like turkey or hummus. 2. Frequent snacking, especially sweet or starchy bites between meals. Why it matters. Constant snacking keeps bacterial activity high and prevents your saliva from doing its regular cleaning job between meals. Swap. Limit snacking to scheduled times and favor snacks that stimulate saliva. Raw vegetables, cheese, if not sensitive, or sugar-free gum with xylitol. 3. Alcohol, wine, cocktails, beer. Why it matters. Alcohol dries out your mouth and reduces saliva flow, which otherwise helps clear bacteria and debris. Alcohol itself can also carry aromatic compounds that linger. Swap. Alternate alcoholic drinks with water and opt for lower alcohol cocktails or a glass of sparkling water with lime in social settings. 4. Processed and fried foods, fast food fried items, packaged snacks. Why it matters. These foods promote inflammation and digestive sluggishness. Greasy residues and poor digestion change the makeup of oral and gut bacteria, increasing malodorous byproducts. Swap. Choose baked or grilled versions or toss a fried snack in a salad with lemon to add acidity that aids digestion. 5. High sodium or instant meals, canned soups, instant noodles. Why it matters. High salt intake can alter hydration balance and the taste environment, sometimes leading to reduced saliva flow and dry mouth sensations. Swap. Rehydrate salty meals with water and add fresh vegetables. Switch to lower sodium or homemade broths when possible. 6. Processed meats and high-protein processed foods, hot dogs, pepperoni, deli meats. Why it matters. Protein breakdown can release amines and sulfur compounds. Processed meats often have additives that can linger and feed bacteria. Swap. Swap processed meats for whole protein options like grilled chicken, canned salmon, or legumes. 7. Dairy and certain cheeses for sensitive individuals. Why it matters. Dairy can leave a film that some people's mouths and tonsillar crypts trap, and in susceptible people, it can be metabolized by bacteria into odor-prone compounds. Swap. If you notice a pattern, try a small experiment. Replace processed cheese snacks with plain yogurt or fermented cottage cheese and see if breath improves. 9. Salty umami additives like MSG and instant flavorings for sensitive people. Why it matters. For some people, these additives alter saliva composition and digestive signaling, which can indirectly favor odorous bacterial byproducts. Swap. Use natural herbs and citrus to boost flavor, and check labels for hidden sodium and flavor enhancers. 9. Coffee and strong teas, especially when consumed all day. Why it matters. Coffee is acidic and can dry the mouth. It also leaves aromatic compounds that can mix with bacterial byproducts and make odors worse. Worse. Swap. Enjoy coffee in the morning, but alternate with water or herbal tea. Rinse with water after the last cup. 10. Low hydration, simply not drinking enough water. Why it matters. Less saliva means less mechanical cleaning and fewer antimicrobial proteins. A dry mouth is an open invitation for bacterial blooms. Swap. Sip water regularly throughout the day. Aim for a glass with meals and a water bottle at your desk. 11. Poor oral care routines. Tongue coating, missed flossing. Why it matters. The tongue holds most of the microbes that produce VSCs. Plaque between teeth is a steady food source for those microbes. Swap. Add gentle tongue scraping to your routine and make at least once daily flossing a non-negotiable. 12. Certain medications that reduce saliva, antihistamines, some antidepressants. Why it matters. Many medications have dry mouth as a side effect, which gives bacteria a drier, stickier environment to thrive. Swap. Don't stop medications. Instead, talk to your prescribing clinician about alternatives or saliva-stimulating strategies like sugar-free gum or saliva substitutes. 13. Tonsil stones and chronic sinus issues. Why it matters. Crypts and tonsils can trap food debris and bacteria, producing a localized source of malodor that doesn't respond to minty breath fresheners. Swap. See an ENT or your dentist if you suspect tonsil stones. In the meantime, saltwater gargles can help reduce debris. 14. Overnight teeth/nighttime habits. Late night snacking, mouth breathing during sleep. Why it matters. Fasting saliva flow during sleep plus late snacks means bacteria are active longer without your mouth's daytime cleaning. Swap. Skip late-night high-sugar snacks and consider a bedside humidifier or treats that keep the mouth moist if you breathe through the mouth. 15. Sugary, sticky condiments and dried fruits that cling to teeth. Why it matters. These stick and slowly release sugar, prolonging bacterial feeding cycles long after you finish eating. Swap. Rinse with water after sticky foods, brush if possible, or choose fresh fruit over sticky dried versions. That list is a fast map. Some of these culprits act directly, feeding bacteria or reducing saliva, while others act indirectly, changing your digestion or the makeup of your oral microbiome. The key to remember, mints and mouthwash cover odor temporarily, but they don't stop the food-driven chemistry that keeps the smell-producing bacteria in business. So, which of the items above is the #1 dietary driver? Which one is the title referring to when it claims 90%? The short answer, refined sugars and refined carbohydrates. Everything from the obvious candies and sodas to the less obvious white bread, many packaged breakfast cereals, sugared yogurts, and that mid-afternoon pastry.
Refined carbs break down quickly into simple sugars, they're everywhere in the modern diet, and they create the environment many oral bacteria thrive on. Let's unpack the biology so the problem stops being mysterious and starts being manageable. Think of your mouth as an ecosystem.
Some residents are harmless, some helpful, and some opportunistic troublemakers. The bacteria that make breath smell bad are mostly anaerobic and live in the low oxygen pockets of your mouth, in plaque along the gum line, in crevices between teeth, and on the rough, papillae-covered surface of the tongue. Many of these bacteria feed on proteins and sulfur-containing amino acids, but they absolutely love sugars and rapidly digestible starches because those give them a fast energy burst that fuels rapid growth and stronger metabolic activity. When these bacteria metabolize sugars, a few things happen that matter for breath. They produce volatile sulfur compounds, VSCs. These are the classic stinky gases most people associate with halitosis. Hydrogen sulfide, like rotten eggs, methylmercaptan, and other sulfurous compounds that our noses pick up as offensive. VSCs are small, volatile, and easily carried in your exhale. They lower the local pH and promote plaque formation. Acidic byproducts encourage more bacteria to stick together and form biofilm, the sticky, hard-to-remove layer that becomes plaque. More plaque means more hiding places for VSC-producing microbes. They create a longer window of activity. Simple sugars give bacteria fuel that keeps them active between cleanings, especially if you snack frequently. Think of each sugary snack as lighting a match. Every match ignites a few more bacteria into action. Refined carbohydrates deserve special emphasis because some people don't think of them as simple sugar. White bread, crackers, mini snack bars, and even some whole grain packaged items often break down quickly into glucose in the mouth and gut. That's why someone who avoids obvious sweets but eats a lot of bread and crackers can still have persistent bad breath. There's also the saliva piece. Saliva is your mouth's frontline cleaning system. It mechanically washes away debris, buffers acids, and contains antimicrobial proteins and enzymes. When saliva flow is normal, a lot of what bacteria produce gets diluted, swallowed, or neutralized. But sugar-rich and high-frequency eaters tend to have more sustained bacterial activity that challenges saliva's capacity. Add common drying factors, alcohol, dehydration, some medications, mouth breathing, and you've got a scenario where saliva can't keep up. Another important nuance: not all bacteria that smell foul are the same. Some metabolize proteins into amines and fatty acids, which smell fishy or cheesy. Others produce strong sulfur compounds. Diet influences which groups dominate. A carb-heavy diet tends to favor certain fermentative bacteria that produce both VSCs and acid, whereas high-protein diets may fuel different odorous pathways. In many real-world cases, however, refined sugar and frequent carbohydrate exposure are what tip the balance toward a persistent sulfurous morning breath that never fully clears. It's worth pausing here to stress caution and perspective. Bad breath doesn't have a single cause, and food is just one piece of the puzzle. Dental disease, gum inflammation, tonsil stones, chronic sinus inflammation, and some medical conditions can all produce or amplify malodor. If you've made multiple dietary and hygiene changes and the problem continues, see a dental professional or your doctor. There may be an underlying issue that needs treatment. But for the majority of diet-driven cases, changing what you eat and how often you feed the bacteria can make a tangible difference. So how immediate are the effects when you cut down on refined sugars? Many people notice an improvement in subjective mouth freshness within a few days of reducing sugary snacks and improving hydration. Measurable reductions in certain VSCs happen on a similar timescale for many individuals. That said, if you have established periodontal disease or heavy plaque buildup, those conditions require professional cleaning and follow-up. Simple dietary changes are powerful, but they're part of a layered approach.
cleaning, hydration, and targeted swaps. Because the refined sugar problem is so central, let's go deeper into the kinds of sugars and carbs that matter most and why the hidden forms are often the sneakiest. Obvious sugars, candies, pastries, sodas, sweetened drinks. These provide a rapid spike of sugar in your mouth and are easy fuel for bacteria. Less obvious refined carbs, white bread, mini bagels, plain crackers, many store-bought breakfast cereals, even those marketed as low-fat or healthy, instant oatmeal packets with added syrup, and mini snack bars. These often digest into glucose quickly and stick around teeth, giving bacteria a slow-release source of food. Sticky sugar carriers, dried fruit, fruit leathers, caramel-based snacks, and chewy candies. Their sticky texture clings to teeth and in crevices, prolonging bacterial activity. Sugars in beverages, fruit juices, sweetened teas, sports drinks, and even certain flavored water enhancers. Liquids bathe the mouth in sugar and may not trigger the same protective chewing saliva reflex that solid foods do. One more point about frequency. A soda at lunch is less of a problem than sipping a sweetened iced tea all afternoon. It's not only how much sugar you eat, but how often your mouth is exposed that determines whether saliva gets a chance to clear and reset the microbial environment. Because this is a lot to keep in your head, here are two immediate replacements that often shift the balance within days. 1. Candy or sweet snack, fresh fruit plus unsalted nuts. The fiber in fruit slows sugar absorption and provides bulk that stimulates chewing and saliva. Nuts add protein and fat that blunt glucose spikes. 2. White bread or bagel, whole grain bread plus protein, egg, cheese, or nut butter. The extra fiber and protein slow digestion and reduce the amount of free sugar available to oral bacteria.
Those are simple swaps, but they matter because they change the fuel available to bacteria. Swap enough of them and you change the ecosystem. Now let's examine a few mechanisms that link refined sugars to different forms of bad breath in more detail, because understanding the why helps you choose the how of change. Fermentation and VSCs. When bacteria ferment sugars, they produce gases and acids. Some byproducts are VSCs that smell like sulfur or rotten eggs. Others are organic acids that create that sour, lingering breath that many people describe as sour coffee breath. Biofilm reinforcement. Sugars increase the stickiness of biofilm. Plaque becomes harder to remove and forms a protective environment where bacteria communicate, share nutrients, and exchange survival strategies. This thicker plaque houses more odorous bacteria. Increased tongue coating. Sugary diets tend to increase the debris and mucus-like coating on the tongue. The rough surface of the tongue traps bacteria and food particles, and those trapped particles become a slow-release source of malodorous compounds. Altered oral gut axis. High sugar diets can shift the balance of both oral and gut microbiomes. While the direct relationship between gut bacteria and halitosis is complex and sometimes overstated, changes in digestion and reflux can bring odorous compounds closer to the mouth. For example, indigestion or delayed gastric emptying allows volatile compounds to move upward. This thicker plaque houses more odorous bacteria. Dry mouth synergy. Many sugar-rich foods are paired with behaviors or substances that dry the mouth. Think sugary cocktails, caffeinated beverages, or nighttime snacking followed by sleep. When saliva is reduced, the same amount of bacterial activity produces a louder odor because it isn't diluted or cleared. At this point, you might be thinking, okay, I eat sugar sometimes. Does that mean my breath is doomed? Not at all. We're trying to make this practical rather than punitive. The body is resilient. Small, consistent adjustments often produce outsized results. The goal is to reduce the frequency and accessibility of simple sugars to the bacteria that make breath smell, while also supporting saliva flow and mechanical cleaning. There's an important behavioral angle here as well. Many people use sugar-containing products as comfort or habit. A pastry with coffee, a soda with lunch, a quick candy after dinner. Those moments are cues, triggers you can rewire.
Replace the cue, stress, boredom, or routine with a different behavior. Walk for 2 minutes, eat a piece of fruit, chew sugar-free xylitol gum to break the chain of constant feeding. Before we move into other culprits and begin building practical routines, I want to highlight one clinical safety note. If you've reduced refined sugars and improved hygiene and your breath still doesn't improve, please seek professional evaluation. Persistent halitosis can be a sign of periodontal disease, chronic sinusitis, significant tonsil stones, or other conditions that benefit from clinical care. Dentist quote required. Don't treat this topic like a cosmetic problem only. Our mouths are connected to the rest of the body. Next, we're going to pivot briefly to several secondary mechanisms that often work in tandem with sugar to make bad breath worse. Understanding these will help you prioritize which small changes will make the biggest difference for you personally. We'll start with one of the most common and underappreciated partners, alcohol. Alcohol is a double troublemaker. First, it dries the mouth by reducing salivary flow, and a drier mouth gives bacteria a head start. Second, alcoholic beverages contain aromatic molecules that can linger on the breath. So a night of drinking can do more than just cover odorous compounds. It creates an environment where those compounds are produced in greater quantities. But alcohol's role is rarely isolated. People often pair alcohol with salty snacks or processed meats, think pretzels, chips, or a charcuterie board. Those foods further supply protein and fats that bacteria can metabolize into amines and sulfurous compounds. The result? A layered, persistent smell that mouthwash temporarily masks but doesn't solve. We'll return to alcohol's practical swaps in a minute, but first a quick word about dairy and processed cheeses. Many people believe milk causes bad breath universally. This isn't accurate. For some individuals, dairy can increase tongue coating or interact with sinus mucus in a way that makes odors worse. For others, fermented dairy like plain yogurt can be neutral or even beneficial because probiotic strains may compete with odor-producing microbes. The takeaway? Dairy-related breath problems are individual. Experiment and observe. Another major partner in malodor is processed and fried food. These foods drive systemic inflammation and slow digestion for some people. Poor digestion and sluggish gut motility can increase the odds that odorous compounds travel upward or are exhaled. Additionally, fry oils and certain additives linger on the mouth surfaces, providing more substrate for bacteria. In other words, a diet heavy in packaged and fried foods doesn't just feed oral bacteria directly. It creates a body environment that favors persistent odor. One more factor worth calling out now is medication-induced dry mouth. Many common drugs, from antihistamines and some antidepressants to blood pressure medications, have dry mouth as a side effect. That reduced saliva opens the door for bacteria to proliferate. If you suspect your medication contributes to dry mouth, don't stop it. Talk to your prescriber about alternatives or mitigation strategies, like sucking on ice chips, chewing sugar-free gum, or using saliva substitutes. We've covered a lot so far. The fast list of culprits, the central role of refined sugars and refined carbs, the biological mechanisms that explain the connection, and a preview of secondary forces that amplify the problem. Up next, we'll get practical. Step-by-step changes you can implement today to reduce bacterial fuel, support saliva, clean the tongue, and make sure your efforts are matched by the right professional checks. We'll translate the biology into habits. What to stop, what to swap, what to add, and when to see a dentist. Before we get into that toolkit, take a breath and think about one eating habit you do every day that might be feeding bacteria. Make a mental note. Later, we'll show how to replace that one habit with a simple swap that reduces VSC production and helps you wake up without that stale morning cloud. Good. You picked a habit to target. Now we turn that idea into a specific plan, a step-by-step toolkit you can start using today to reduce the fuel for odor-producing bacteria, protect saliva, and clean the places mints and sprays miss. These are practical moves, explained simply so you can pick a few and begin testing what actually helps you. Start with immediate actions you can do within minutes. First, the tongue. The rough surface of the tongue traps most of the microbes that produce volatile sulfur compounds. Gently scraping the tongue once a day, ideally in the morning, removes that slimy coating and a big portion of the bacterial load. Use a soft tongue scraper or the back of a toothbrush. Drag from the back of the tongue forward 3 to 5 times, rinse, and repeat until the scraper comes away cleaner. Don't be aggressive. You want to remove debris, not irritate the tissue. If you gag easily, try scraping in small sections and breathe through your nose. This simple step alone often produces a noticeable improvement in perceived freshness. Second, floss. Plaque between teeth is a steady food source for odor-producing bacteria. Floss once daily, after your last meal if possible, so leftover carbs and proteins aren't sitting overnight where bacteria can break them down. Use unwaxed or wax floss as you prefer. The technique is straightforward. Form a C shape around each tooth and gently slide below the gum line. If traditional floss is difficult, try interdental brushes or a water flosser. The goal is to disrupt plaque, not to perform a clinical exam. Third, hydrate and stimulate saliva. When your mouth is moist, odors are diluted and debris is washed away. Instead of waiting until you feel thirsty, keep a water bottle within reach and sip consistently. After meals, chew sugar-free gum with xylitol for 10 to 20 minutes to stimulate saliva production. Xylitol has the added advantage of being non-fermentable by many oral bacteria. If you have severe dry mouth, ask your provider about saliva substitutes or prescription options. Don't stop medications on your own. Fourth, time your mouthwash. Mouthwashes that contain alcohol can temporarily reduce odor but also dry the mouth, which may make the problem rebound. Use a non-alcoholic antiseptic mouthwash or a simple saltwater rinse when you need a refresher. Remember, mouthwash masks odors briefly. It doesn't remove the biofilm or change the long-term food supply for bacteria. Fifth, reduce late-night snacking. Eating sugary or starchy foods before bed gives bacteria time to work while saliva flow is naturally reduced during sleep. If you must snack, choose something that stimulates saliva and isn't loaded with free sugars. An apple with a handful of almonds, a small piece of cheese if dairy doesn't bother you, or raw veggies. Now we translate those immediate actions into a targeted daily routine you can try for 2 weeks as an experiment. Morning routine. Scrape tongue, brush teeth for 2 minutes with fluoride toothpaste, floss or use an interdental cleaner, and finish with a glass of water. If you drink coffee in the morning, rinse with water afterward or finish with a small glass of water to reset the oral environment. Midday routine. After lunch, rinse with water and chew sugar-free xylitol gum for 10 minutes, especially if you can't brush. If you have time, follow with interdental cleaning. Evening routine. Floss thoroughly, brush or use an electric toothbrush, and scrape the tongue. Avoid sugary desserts after dinner, and, if you do, a small carbohydrate snack, wait to brush until after it. Hydration and throughout the day. Sip water often. If you work in an environment where water access is limited, carry a small bottle or set a reminder to take a drink every 30-45 minutes. If you take medications that dry the mouth, coordinate sips or gum after dosing times. Next, specific swaps for the major culprits we listed earlier. For each food category, here are at least 2 practical replacements or strategies you can use. Think of this as a menu of options so you can pick what fits your taste and lifestyle. Refined sugars and white starches. Swap A. Replace candies and pastries with whole fruit plus a small handful of unsalted nuts. The fiber in fruit slows sugar release and chewing increases saliva. Swap B. Choose whole grain bread or seeded options paired with protein, an egg, lean turkey, or nut butter so glucose isn't available in a rapid free form. Frequent snacking. Swap A. Schedule 2 to 3 satisfying snacks instead of continuous nibbling. Choose crunchy raw vegetables or a piece of cheese to stimulate saliva. Swap B. Replace mindless snacks with a short activity that breaks the cue. Stand and stretch, walk for 5 minutes, or drink a full glass of water. Alcohol. Swap A. Alternate each alcoholic drink with water or sparkling water with citrus to maintain hydration and reduce total alcohol exposure. Swap B. Choose lower alcohol options or a single small glass of wine rather than several cocktails, Avoid sipping slowly on one drink for hours.
Processed and fried foods. Swap A. Order grilled or baked versions when dining out. If you must have a fried item, pair it with a large fresh vegetable salad and a squeeze of lemon to encourage digestion. Swap B. Replace packaged chips or crackers with air-popped popcorn or roasted chickpeas for crunch without the heavy grease. High-sodium instant meals. Swap A. Dilute instant soups with water and add fresh vegetables or a squeeze of lemon. This reduces salt concentration and adds fiber. Swap B. Keep simple, low-sodium staples on hand, homemade broth, plain canned beans, and frozen vegetables to avoid reaching for instant meals. Processed meats, high-protein processed foods. Swap A. Substitute deli meats with grilled chicken, canned tuna and water, or sliced roasted vegetables and hummus. Swap B. Try plant-based protein options like lentil salads, tempeh, or edamame for protein that doesn't come with high levels of preservatives. Dairy and certain cheeses for sensitive individuals. Swap A. If you notice breath worsening after processed cheese snacks, try plain yogurt with live cultures or kefir, which may support beneficial microbes. Swap B. Use small portions of aged cheeses that are less likely to leave film, or pick fresh cheeses paired with whole grain crackers and fruit to balance sugars. MSG and instant flavorings, sensitive people. Swap A. Season with fresh herbs, citrus zest, and a touch of olive oil instead of flavor packets. Swap B. When cooking at home, use small amounts of natural umami, mushrooms, tomatoes, miso, instead of packet seasonings. Coffee and strong teas. Swap A. Have your morning coffee, then switch to water or herbal tea. Rinse your mouth with water after the last cup. Swap B. Reduce intensity by mixing your coffee with extra milk or plant milk that helps coat and dilute some of the aromatic compounds. Low hydration. Swap A. Keep a reusable water bottle and set a phone or watch reminder for hourly sips during the day. Swap B. Add hydrating foods to your plate, cucumber, watermelon, oranges, to increase water intake through food. Poor oral care routines. Swap A. Add a 60-second tongue scrape to your brushing. If you only do one change, make it tongue scraping. Swap B. Replace quick flossing with a thorough nightly interdental routine. Pick a dedicated block of time to do it so it becomes habitual. Medications causing dry mouth. Swap A. Speak to your prescriber about timing. Some meds cause less dryness if taken with food or at certain times. Always consult before changing dosing. Swap B. Use saliva-stimulating tactics like sugar-free lozenges, sipping water, or chewing xylitol gum around dosing times. Tonsil stones and chronic sinus issues. Swap A. Saltwater gargles after meals can help loosen debris from tonsillar crypts until you can see a specialist. Swap B. Consider a nasal rinse for chronic sinus drainage. If tonsil stones persist, discuss removal options with an ENT. Overnight teeth, nighttime habits. Swap A. Make a hard rule, no sugary late-night snacks after 8 p.m. If you need something, choose a non-sugary small protein. Swap B. If you breathe through your mouth at night, try a humidifier in the bedroom and discuss evaluation for sleep-disordered breathing. Sugary, sticky condiments and dried fruit. Swap A. Replace sticky dried fruits with fresh fruit and a small protein, like apple slices with almond butter. Swap B. Rinse or brush after eating sticky condiments. Keep travel toothbrushes or floss picks at the office or in your bag. These swaps are not punitive. The idea is to reduce the frequency and accessibility of free sugars and starches that feed opportunistic bacteria, while keeping eating enjoyable and sustainable. If you want to find your personal triggers, run a short elimination experiment. Pick 2 habits you suspect are feeding bad breath, maybe afternoon sodas and late-night crackers, and remove them for 2 weeks while keeping everything else the same. Keep a simple log.
Note what you ate, when you brushed, whether you cheated, and how your mouth felt in the morning and during the day. You can use the gauze test, drag clean white gauze across the back of your tongue and smell it, or a partner's feedback for subjective measurement. Some clinics measure VSCs professionally. If you want objective data, ask your dentist whether they use halometers or other methods. By the end of 2 weeks, you'll likely see which changes make the biggest difference for you. Now, a deeper look at a few targeted tactics that are effective but often overlooked. Tongue scraping technique. Use light pressure, start at the back and move forward. Rinse the scraper between passes. Do this in the shower or over the sink. People often neglect the visual cue that helps them remember a new habit. If you have a coated tongue consistently, it may indicate a need for a dental check because heavy coating can mean higher bacterial loads or issues with saliva. Timing of meals. Reducing grazing and creating windows when saliva can reset the mouth reduces the number of times bacteria get a fresh glucose hit. Aim for 3 structured meals and 1 or 2 planned snacks. If your job forces frequent nibbling, choose tooth-friendly options and follow them with water. Chewing gum and xylitol. Chewing stimulates saliva and helps wash away food particles. Xylitol appears to be less fermentable by certain oral bacteria and may reduce caries risk. Use sugar-free gum with xylitol and avoid gum with sorbitol or excessive artificial sweeteners that can cause gastrointestinal upset in sensitive individuals. Probiotics and fermented foods. There's growing interest in probiotics for oral health, but evidence is still emerging. Fermented foods like plain yogurt, kefir, and some fermented vegetables contain strains that may help balance microbes, yet results vary widely by product and person. If you try a probiotic, use it as part of a broader plan, improved oral hygiene and decreased sugar exposure, and discuss long-term use with your healthcare provider. When to escalate? See the dentist or ENT. If you've consistently reduced sugars, followed the hygiene and hydration routine for 2 to 4 weeks, and your breath hasn't improved meaningfully, it's time to see a professional. Persistent halitosis can be caused by periodontal disease, deep plaque or calculus, tonsillitis, chronic sinusitis, or less commonly, systemic conditions that require medical assessment. A dentist can check for gum disease, measure pocket depths, look for tonsil stones, and evaluate restorations that trap food. An ENT can evaluate chronic tonsillar issues or sinus drainage. If your provider suggests it, ask about professional VSC measurement and targeted treatments for periodontal disease. Don't treat persistent breath as a cosmetic issue. This is a medical conversation that may uncover treatable conditions. A practical dental checklist to bring to your appointment will make the visit efficient. Note when the problem started, list changes you've tried and their results, bring your medication list, many drugs cause dry mouth, and report any related symptoms like a persistent bad taste, bleeding gums, or chronic sore throat. That context greatly speeds up diagnosis. Long-term dietary patterns that support fresher breath. Think in terms of balance and frequency. Adopt an eating pattern that keeps glucose spikes moderate and provides fiber, protein, and healthy fats at meals. A Mediterranean-style pattern, vegetables, whole grains, legumes, lean proteins, nuts, cheese in moderation, and fermented foods tends to reduce inflammation, support a diverse gut microbiome, and decrease the constant carb exposure that feeds opportunistic oral microbes. This isn't about perfection. It's about shifting the ratios so the bacteria have less of the quick fuels they prefer. A few myths to dispel while we're here. Brushing immediately after an acidic snack or fruit juice can damage enamel. If you consume acid, wait 20-30 minutes and rinse with water before brushing. Chewing parsley, mint, or other herbs is a short-term mask but also stimulates saliva. So used strategically, herbs can be part of an overall approach. And no, chronic bad breath is rarely caused solely by the stomach. Most odor originates in the mouth, though reflux or significant gastrointestinal issues can contribute in some cases. Let's bring all of this together into a simple action plan you can apply this week. Choose one item from each column and commit to it for 7 days. Small, consistent changes stack into big effects. Stop, Remove one sugar-heavy snack, e.g. sugary coffee drink or candy. Swap. Choose a whole grain plus protein alternative, e.g. whole grain toast with egg or Greek yogurt with nuts.
Add, commit to tongue scraping each morning and flossing nightly. Support, carry a water bottle and a pack of sugar-free xylitol gum for after-meal stimulation. Check, if no improvement after 2 weeks, make a dental appointment and bring your symptom log. Back to the title claim for a moment. This common food causes 90% of bad breath cases. We treat that number as the focal claim in the headline, and you'll see it flagged here as well. The idea is that refined sugars and refined carbohydrates are the leading dietary drivers of diet-related halitosis in many clinical and popular analyses. That doesn't mean sugar is the only cause. Dental disease, tonsil stones, sinus problems, and medications can and do cause persistent halitosis. But for diet-related breath problems, refined sugar and rapidly digestible carbs are consistently implicated as the primary fuel for the bacteria that produce the worst-smelling compounds. Think of the 90% as a strong way of pointing your attention to what's most worth changing first. If you want one simple first step to test today, pick the one sugary or white starch snack you do every day, your afternoon pastry, your office candy drawer habit, or your bedtime ice cream, and replace it with a fruit plus protein or a whole grain plus protein pairing for 1 week. Keep a note of morning breath quality and energy levels. Most people report a subjective improvement within days. Objective bacterial reductions can take a little longer depending on baseline oral health. Before we wrap, a quick safety note. Don't stop medications without talking to your physician. If you suspect medication-induced dry mouth, request a medication review and discuss mitigation strategies. And if you experience a sudden change in breath accompanied by weight loss, persistent fever, or other systemic symptoms, seek medical attention promptly. To recap succinctly, the food category we spotlighted, the refined sugars and refined carbohydrates that show up in candies, many pastries, white breads, some cereals, and sticky snacks, is the central dietary driver of many cases of halitosis because it provides fast, fermentable fuel for the anaerobic bacteria that produce volatile sulfur compounds and other odorous metabolites. Reduce the frequency and accessibility of those sugars, support saliva, clean the tongue and interdental spaces, and you'll often see meaningful improvement. If improvement doesn't happen, see your dental or medical provider to rule out non-dietary causes. Finally, a short practical checklist to keep on your phone or fridge. 1. Morning. Tongue scrape plus brush, floss, water. 2. Day. Limit grazing. Choose 2 structured snacks, sip water, chew xylitol gum after meals if needed. 3. Night, no sugary snacks, floss, brush, tongue scrape. 4. Week, swap one refined carb habit for a whole food alternative, track breath quality. 5. Month, dental check if no significant improvement or sooner if you notice bleeding gums, pain, or persistent tonsil stones. Small changes compound quickly. We've seen people reduce the intensity of chronic bad breath by shifting what's on their plate and by following a reliable hygiene routine. That's the empowering part. You don't need to live with perpetual embarrassment or rely only on mints that mask the problem. Change the fuel, protect saliva, and clean the places bacteria hide. If this video helped you see where to start, subscribe to Health Wisdom for straightforward, evidence-informed tips you can apply to everyday health problems. Also, check the description for sources and a link to our related video on simple dental habits that make your mouth healthier in 2 weeks. If you're ready to commit to one swap this week, tell us in the comments which habit you'll change. Your note might help someone else decide where to begin. Remember, the 90% figure is a headline cue. Look for the citation in the description if you want to review the evidence. And treat persistent halitosis as a reason to see a practitioner if it doesn't respond to reasonable diet and hygiene changes. Small daily choices add up.
Change the fuel in your mouth, support saliva, and you'll often transform a big, embarrassing problem into a manageable and even reversible habit.